Hi, I'm Rachel, and today I'm going to tell you about cervical cancer and cervical cancer screening. Cervical cancer is the disease in which cancer forms in the cervix. The cervix is the lower end of the uterus, which is the organ where a fetus grows. Many women want to know what causes cervical cancer, so let's review that. Cervical cancer is caused by a virus called human papillomavirus, or HPV. HPV infections are very common. In fact, up to 80% of all women will be infected with HPV over their lifetime, mainly through sexual contact. Most HPV infections, however, go away on their own. There are no effective treatments for HPV infections, but we do know that vaccines help prevent some HPV infections. HPV infections can cause abnormal cervical changes that can become cervical cancer. Abnormal cervical changes take about 10 years to become cancer, but many of these changes return to normal without any treatment. Now we'll discuss what it is actually like to have cervical cancer. Cervical cancer is treated with either surgery or chemotherapy with radiation. Most women will be effectively treated and will not die of cervical cancer. These treatments, however, can lead to bowel and bladder problems and changes in the vagina that make sexual intercourse difficult. These treatments also make most women unable to have children. Some women will die from cervical cancer despite treatment. The good news is that cervical cancer can be prevented by finding and treating abnormal cervical changes before they become cancer. These changes are found by three main tests: a pap smear, an HPV test, and a procedure called colposcopy. Let me explain each of these. We'll start with the one with which you are probably most familiar, the pap smear. A pap smear involves inserting a speculum into the vagina so that a clinician can see the cervix and scrape it with a spatula. This scraping is sent to the laboratory to see if there might be abnormal cervical changes. Results are reported as normal, abnormal, or slightly abnormal. For various reasons, sometimes the test does not work and needs to be repeated. An HPV test also involves a speculum exam and a scraping of the cervix. The test results indicate whether you do or do not have an HPV infection. As with the pap smear, sometimes the test does not work and needs to be repeated. Colposcopy is a magnified view of the cervix to identify areas with abnormal cervical changes. A small piece of the cervix is taken to confirm whether your cervix is normal or has abnormal changes. This is called a biopsy. About half of all women experience pain with a biopsy, and 25% consider the pain to be moderate or severe. Abnormal cervical changes range from being harmless to being serious. In other words, some have a very high chance of returning to normal without treatment, while others have about a 50-50 chance of returning to normal without treatment. Some of the most serious changes, however, have a high chance of becoming cancer if left untreated. You may be interested in knowing how various test results affect women, so let's spend a few minutes reviewing those. As you can imagine, women receiving normal results usually feel reassured. Women with abnormal pap smear results or with an HPV infection, however, often worry about whether they have abnormal cervical changes or cancer. Because HPV infections are sexually transmitted, some women worry about how having an HPV infection might affect their relationships. Women with biopsy results showing abnormal cervical changes may need to have a treatment. They also may worry about whether they have cancer. Since there are several different tests used in screening, let's take a moment to review how they compare in terms of accuracy. Among 100 women with abnormal cervical changes, the pap smear will miss about 25. The HPV test will miss about 10, and colposcopy with biopsy will miss about 2. In other words, although each of these tests find most of the abnormal changes, the pap smear misses the highest number, and colposcopy with biopsy misses the lowest number. The HPV test falls somewhere in between. With all tests, we also have to consider false alarms. A false alarm is when a woman is told that there may be a problem, when in fact there is no problem. Among 100 women without abnormal cervical changes, the Pap smear will have about 5 false alarms. The HPV test will have about 10, and colposcopy with biopsy will have nearly no false alarms. In other words, the HPV test has the highest number of false alarms, and colposcopy with biopsy has the lowest number. The Pap smear falls somewhere in between. HPV tests miss fewer abnormal cervical changes than Pap smears, but have more false alarms. Colposcopy misses the fewest abnormal cervical changes and has the fewest false alarms, but requires many biopsies that can be painful. Finally, let's discuss 3 main treatments for abnormal cervical changes. Abnormal cervical changes can be destroyed by freezing them with a very cold instrument, also called cryotherapy, or by vaporizing them with a laser beam. These changes can also be removed from the cervix with a hot wire, called a leap, or with a scalpel, called a cone biopsy. Less commonly, these changes are treated by removing the cervix and uterus entirely. This is called a hysterectomy. You'll hear a bit more about these treatments during the interview. This concludes our overview of cervical cancer and cervical cancer screening. We have the same information on these cards that you can look at any time during this interview to refresh your memory. Please ask any questions you might have to the research assistant to clarify. And again, thank you for participating in our study.